phones up.
All right.
Take a picture. All right.
Awesome.
All right. You guys are going to be on Facebook. The first thing you need to do is look at your catheter kit, because the hospitals are going to buy whatever kit is cheapest for them. Also, you want to make sure you're getting the kit for what you need to do. Sorry. So, what is the difference between a indwelling catheter and a straight catheter?
That's the
Cat.
Indwelling is otherwise known as the Foley, and it stays in for an amount of time.
Okay, but how is that different than, how is the catheter itself different than a straight catheter?
There's a balloon.
There's a balloon to hold it in place. So you want to make sure, if you're getting a catheter that you want to leave in, that you actually have the correct kit, okay? You also want to look at the size. If you're catheterizing a female, you aren't going to want to use a big old huge 24. So in catheters, the bigger the number, the bigger the catheter. So remember, in needles, it's the opposite way. In catheters, NG tubes, all of that stuff, the bigger the French, the bigger the catheter. So for a girl, a 14, 16 catheter is going to be good. For your older male patients, you're going to want to probably use a 14 or 16, because if you get something too big, you're not going to be able to get through that prostate, okay? When they do urologic procedures, they use like 32 catheters, because they are doing things that are going to cause bleeding, and so you can bet your patients aren't feeling very comfortable with that, right? But you want to look, everything that you need should be in this kit, but you want to make sure you read the contents and make sure that your gloves are in there, everything else that you need is in there, because there's nothing worse than being donned. Oh, perfect, thanks. Have your sterile gloves on and say, crap, I don't have what I need. Also, I'm going to give you a caveat. We have all of these torsos. It was kind of scary for my little grandson who came in with me one day. He's like, what are all these partial bodies? But when you're catheterizing a real patient, you're going to have legs that you have to contend with. So you might need help. Some people in my group last week had to help hold legs for someone they were trying to put a catheter in, because those legs get in the way. Remember, when you are doing sterility, what is considered sterile in your field? 1 inch margin. So once you have your sterile gloves on, you want to do everything you can in your sterile field and make sure you're not contaminating the borders, and then you can actually start your procedure. Once you commit that hand to hold whatever part you're holding, you don't want to have to go back in here, because it's really hard to do stuff. So you're going to set up as much stuff as you can ahead of time. All right, so let's go do this. I have not put a catheter in forever, so I'm letting you record me, but if I mess up, we'll just have to say that. Let me see which one I like. All right, okay. Other people
I'm just moving the screen bubbles.
All right, so ordinarily, our patient's going to have a head. They're going to have legs. Where you set up your tray is going to depend on how cooperative your patient is. Okay, if you've got someone who can open their legs and they hold them there and they're not going to contaminate your field, you can actually set it up on the bed, which is usually the easiest thing to do. But if you've got a confused patient who's kicking and screaming, you might want to pull an overbed table. You have to think about where you're going to put your supplies, because remember, your sterile field is here, and you can't be turning your back. Once you get here, you can't turn your back on it. So the first thing you need to do, open your kit, and feel free to correct me if you see something that I do wrong, because like I said, it's been a while, and this is a skill just like everything else. No pressure here, geez. So it's been a while for me too. I'm sorry? It's been a while for me too. Yeah. So the first thing you want to do, take your plastic bag and use this as your trash bag. I usually like to put it up this way because then I can dump here and I'm not crossing over my stuff that's going to be sterile. You want to look at your kit. Remember, you always open away from you. Okay, so open away. Then here. And then here. And then here. All right. So remember, I can touch my outer edges. And you see how I have it kind of diagonal, so I optimize my space. This top drape is the one we're going to put under the patient's bottom. Shiny side goes down. Okay, I can still touch this because I haven't put my sterile gloves on. Remember, we got that one edge border. If your patient can help you lift, that's good. I haven't contaminated anything yet because everything is still there. I didn't touch anything here. I would like it to be under that butt a little bit better, but I can't do that without contaminating, so I'm going to leave it there. The second drape that is there is called the fenestrated drape. You may remember that from the video. I don't know anybody who really uses that because it just causes more trouble. Most people just toss it. So the next thing I need to do is get my gloves out and that table. I can't set my glove paper down there because when I open it, I don't know what size these gloves are, so I hope this works out.
Sometimes you open them up, they'll be purple, the next day they'll be green.
Just depends on what price break they got that day. Okay, so remember when you're putting your gloves on that you want to lift up from the paper, because if you drag those fingers, you're not going to be good.
Got you guys.
You can get those fingers lined up. That would be good. Sometimes they don't want to go right, and once it's on, you can readjust. Okay. Ta-da! Okay, so I hate this thing, so it's going. Now, I can touch everything that's in here because I have sterile gloves on. I haven't done anything, so I could. I like to move this back and move this piece forward because this is where all the excitement's going to happen. I would open this, get my cotton balls wet, make sure they're nice and juicy.
That's the iodine, right?
That's the iodine. We're not using this. I'm going to put that there. If you have a male catheter kit, which I understand they do make them that way, your lubricant will sometimes come in a syringe, and they actually put the lubricant directly into the penis. It's easier. I just, oh, you know what? We don't have this silicone stuff. I don't think I'm supposed to use this on the mannequins.
Do you know what room it is in?
I don't. You know what? I'm just going to use this, Claire. That's fine. There's only so much simulation I can do. All right, so you put your lube out and toss. You want it juiced up as best you can. Now, we are using barred kits. You need to know your manufacturer. In the video, they taught you to test the balloon. We are not supposed to test the balloon on the barred kits. It has been tested repeatedly, and if you inflate it to test, you might not be able to get it deflated correctly. So you're going to take your, pay attention to where your catheter is going. Mine's trying to get a little bit wayward, but I'm still okay. So you want to get this hooked up. You also want to have this out of the package because once this hand gets contaminated, so I usually put it in my lube, make sure it's set in there well. Okay, good. Whew. Yep, that didn't go where I wanted to. Am I going to deal with that now?
No.
No. All right, so I have my betadine, I have my lube, I have my catheter, my balloon is in. Now I need to commit, and I need to try to find that urinary meatus. So she's kind of stiff, but she has a urethra that looks like this, so it's pretty easy to hit. I am going to take my cotton ball, cleanse away from me. Oops. And there went my thing. Towards me. And then down the center. Okay? That wasn't where I was supposed to put that. That would have contaminated my field and I need to start all over. Okay? So I'm clean. When you're testing, you can actually tell us that. Now I need to insert it into the meatus. And it's not this easy on girls usually. Okay, ignore this. But I want you to see the liquid gold. Okay. So you can see I have urine in the tube. I'm going to push it for a girl. Push it in about 1/2 inch more. Okay, again, ignore this. Because your patients are going to make urine without you doing that, okay? In a man, I push the catheter into the Y because there's nothing worse than inflating that balloon in a man's urethra, and he will not like you very much. So you're going to put this in, inflate the balloon. On some of these simulators, you may not be able to inflate, so you need to know your balloon size, which is on your package. It's also on the side of your catheter, okay? Now, whew, it's in. My sterility piece is pretty well done. I can start doing things. I'm going to secure this to the patient's leg, make my bag dependent, and then I'm going to record the output, the color, the amount, clarity. If I need to send a Kathy away, this would be the time. The system's sterile, so I could send that in my little urine cup. If I needed to send a specimen to the lab at any point after this, I would clamp the tubing down here, and then you can withdraw a specimen here. Never, ever, ever put a clamp on this part of the catheter. I learned that the hard way. Nothing bad happened to my patient, thank goodness, but I had a urologist tell me we were clamping for bladder training, and I had put my clamp up here. If you do that, you can damage the lumen of your balloon, and you won't be able to deflate the balloon. So that would be bad when you're trying to take the catheter out. So we inflated the balloon to put the catheter in. When we get ready to take the catheter out, what do you think we have to do? Deflate the balloon. We have had students who were discontinuing Foley catheters who forgot that step.
And sometimes the patients will get a hold of their tubing if they're confused and yank it out, and the balloon ruptures, so it doesn't actually hurt as much as you think it would, because it breaks usually. But every once in a while, somebody will.
Oh, I've seen them come out intact.
The balloon is intact, yeah. So you know that was a bad ride out.
Okay, did that help?
Yeah.
Okay. So other than my one contamination where I put my, I don't know what I was thinking when I put my cotton ball back in there, I think I did a good job. Yay!
Mr. Wilson?
Yes.
So when you